Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. Subscribe at kevinmd.com/podcast. Today, we have a special sponsored episode by Nuance, a Microsoft company. We welcome Patrick McGill. He's a family physician and executive vice president and chief transformation officer at Community Health Network. Dr. McGill is responsible for population health management, value-based care, envisioning data-enabled strategies, overseeing information technology and digital transformation, and leading communities' effort to use analytics to drive transformation. Today, we're discussing improving care with AI-powered solutions. For more information, go to nuance.com/Kevin. That's nuance.com/Kevin. And you could also click the link in the show notes. Patrick, welcome to the show.
Thanks for having me. Really appreciate the invite to come on.
So let's start by telling our viewers a little bit about yourself, where you are today, and how you got there.
Absolutely. So I'm a family physician. Still practice, see patients one day a week, and like you said, serve as the chief transformation officer. So I really, it's really an interesting journey. I don't have a technology background, and we installed Epic about 12 years ago, and I got tapped on the shoulder to lead optimization afterwards. I was just a practicing family physician at the time. And it's one of those stories. It's a career journey of you get tapped on the shoulder and you keep saying yes, and you get tapped more and say yes. And so eventually that led into a lot of varied experiences, leading efforts around population health and value-based care. Beginning in 2018, I took over analytics, and then that led to integrating information technology under the Office of Transformation. So right now I have a broad range of responsibilities, but it makes a lot of sense because it allows us to be data driven,
Mhm.
technology driven as we're, trying to deliver our brand promise of exceptional care simply delivered.
Technology has been a focal point in your career in medicine. Tell us a little bit more about why you're passionate about technology and how you view its role in healthcare.
Yeah, I've always viewed technology as critical. You know, I'm of the age where, when I started med school and residency, we were on paper, and then the introduction of electronic medical records and e-prescribing and some other things. So I really saw the value where technology was used to assist clinicians. Very passionate about decision support. How do we make clinicians, physicians, and APPs smarter and better to allow them to do the things that they're trained to do? Let's take some of the easy burdensome work off of their plate. And it's not just about EMRs, right? It's all the other things that occur in healthcare. It's all the friction points that patients are frustrated with that frustrate clinicians and other staff as well. So I'm really passionate that I do think that technology is not the only answer, but it's absolutely an answer to some of those problems. And I think as technology is advancing, specifically with AI, which I know we'll get into later, I think that's going to take it to the next level. And so I'm really excited about, where we're going, where we're headed. I always tell people like you would never practice medicine without a stethoscope, right? So you're not going to practice medicine in 2024 without some sort of technology, whether it's an EMR or assistive decision support type of technologies.
So, as technology shifts towards leveraging artificial intelligence to advance its capabilities, how do you see AI helping to solve the problems in healthcare?
I'm cautiously optimistic. And what do I mean by that? I'm very bullish that I think that it can solve a lot of the problems. I think it can solve a lot of the burdens that people are frustrated with, a lot of the things that have caused burnout related to the EMR and others. And we'll talk about one about around documentation. I think that there's a lot of opportunity in some of the repetitive work that AI can help with. A lot of the things that, like we talked before, the friction points that patients run into, whether it's prior authorization or referral management, scheduling appointments, all of those things. And really, it's the vision to make healthcare and medicine more personalized. I always say we've had one segment, and that's called the patient. And other industries have really focused to make those industries more personalized and segmented. And I think we can do the same. We can achieve the same in healthcare. And I think that's where technology can solve some of that to make it more personalized, more specific, so that we see each patient or person as a person, so that we know them deeply and have that relationship. And that probably comes from my background as being a family doctor and having long-term relationships with patients. I think that's so important to really know people, build the relationship and the trust. And I think technology is if we use it correctly, will allow people to get back to doing what they love to do, which is taking care of people.
Now, can you explain how you and your colleagues at Community Health Network, how are you using technology and AI today and why you turned to AI as a solution?
Yeah, so we've started several years ago leveraging AI a lot in the rev cycle space, a lot of those repetitive tasks. And now we've moved into AI to drive prediction. And so can we predict who's going to deteriorate? Can we predict who needs to come into the office? Can we predict who would be safe to be discharged early from the hospital? And so really a lot of those predictions, machine learning and AI, drive assistance with making clinical decisions, not making the clinical decisions, just assisting our physicians with their decisions. Now we've moved into documentation and we're looking at other things around pre-visit planning and assistance with decision support. Obviously, reading the notes to pull out additional information that may be buried in the EMR that clinicians or physicians aren't seeing or just don't have the time to comb through the notes. And so, how do we create summaries? Using AI to help patients understand, right? So, translating into other languages for patient instructions. Some of those things that we might take for granted in other areas are a little more complex in healthcare. And that's where I think that technology and AI. That's how we see it and how we're using it.
As healthcare facilities integrate AI, some of the earliest wins for physicians revolve around the administrative burdens, as you said, clinicians face every day, especially clinical documentation. So tell us your experience with that.
Yeah, so I'll tell you two pieces. One, my personal experience, and the other is kind of my experience as a leader. And so, my personal experience is as I still see patients, I'm responsible for documenting those visits. And what I find is the busier you get, the shorter those document and the less detailed those documents, the documentation becomes. And so it's kind of the opposite of note bloat. We can use a lot of links and other things to pull in a lot of information into the notes, but it just becomes unusable or unreadable. So the counter is how do we make them more streamlined and more usable or readable? And I think the pendulum swings to where they're just not, they don't have enough detail. They don't capture the conversation or the history or other things. And so it's a balance, right? It's a balance between how much time do you spend documenting, how much time do you spend reviewing the chart, and the number of patients that you see. So that's my personal experience. From a system level, we want accurate documentation. Obviously, it's critical, it's key. We tell people all the time, you take care of a lot of sick people. We need to document better how sick they are. As physicians, we often just jump in and take care of people, and we know the complexities in our head. We know the extensive differential diagnoses that we're thinking about and all the factors, but it just doesn't get translated into the chart. And so, how do we use technology and AI to really leverage and help to get a lot of that documentation? So that's really, I think clinical documentation is one area that I think it's overwhelmingly, consistent that that's been a major contributor to burnout and frustration with the EMR. And I think that there's obviously better ways and with new technologies we're tackling that.
So let's talk about one solution now, DAX Copilot
Right.
from Nuance, a Microsoft company. What exactly is DAX Copilot and how does it work?
Yeah, DAX Copilot stands for Dragon Ambient Experience, and so it's the ambient listening tool from Nuance that listens during an exam or in a office encounter to capture the conversation and consistently condense, summarize, consolidate, whatever word you want to use to aid and assist in documentation. So think of it as a scribe. It's an AI scribe. I think it's probably the easiest way, but it's smarter than just a scribe. It's not just writing down everything that's said as a transcript. It really does summarize the conversation and is smart enough to put it in specific areas in the section, whether it's a past medical history or HPI or plan, etc.
So, how has DAX Copilot changed the way you practice medicine? And maybe you could share a story about how DAX Copilot really changed your practice.
Yeah, I tell people that. So I've been live with Dax for probably about 6 months now, Dax Copilot. And, I started my career in informatics and my administrative career in informatics. It was one of the first cohorts for physician builders with Epic and used to teach and train people how to use Epic, how to use all the smart tools and everything else. But So I say that because I'm a proficient user of Epic, right? I know how to use the
Mhm.
tools. I know how to use all the smart tools to make things better. But I still, as a busy family doctor, I still was not able to get my notes closed by the end of the day. So even with all that knowledge and education and training, DAX Copilot really, and I don't say this lightly, really has been probably the most game changing technology that we've implemented in the last 10 years since we went live with Epic. It really does. So now, instead of leaving clinic with 25 or 30 open charts, I leave with zero. I've not, in this last 6 months, I've not had an open chart when I've left clinic. Oftentimes I walk out of the room and close my chart, review the note, close my chart immediately. It's that fast. And so what it does from a physician standpoint, it really does allow me to go back to having a conversation, having a face-to-face conversation with the patient. The only thing I'm on the computer for is to enter orders, or if I need to go back and review something in the chart. It's capturing all of that dialogue between the patients. So it honestly, it's brought some joy back because I'm not focused on what did they say, what was that detail, who was that family member that had cancer. It's all getting picked up by the ambient technology, and so it allows me to go back to what I enjoy doing, which is being a family doctor and taking care of people.
So I'm a primary care doctor like yourself. So you're saying in a typical visit, 15, 20 minutes or so, your chart is closed after seeing that patient?
Absolutely. So walk out of the room. Within seconds, the visit is summarized. I review it, make sure it's accurate. I still am responsible for the documentation, so I'm reviewing for accuracy. Did it pick up the right laterality? Did it pick up the right, what we were talking about? Do I need to add any details? Maybe it didn't capture the full details of the exam or something similar, and then close the note.
Today, we have a special sponsored episode brought to you by Nuance, a Microsoft company. We're discussing improving care with AI powered solutions. For more information, go to nuance.com/Kevin. That's nuance.com/Kevin. You can also click the link in the show notes. Patrick, how have your patients reacted to you using AI to automate clinical documentation?
I think the patients, so I have not had any negative pushback or feedback from patients. Quite frankly, I think patients expect us to use technology now. They're used to, 10 or 15 years of EMRs. They're used to that. They're very proficient in communication. So really don't have any pushback. Now with information blocking, with the immediate release of notes, they're reading the notes, and I think that they see the difference between my old notes and my new notes, that the new notes are actually capturing what happened in the exam, in the exam room, not just a shorthand summary of my thoughts and what I can remember. So I do think that patients are going to start to notice. I think this is going to be an example where when they see multiple physicians or clinicians, they're going to notice people that are using these assistive technologies because the notes are more complete versus kind of the old style that a lot of physicians document in.
Do you have to introduce to the patient that you are using some type of ambient listening technology before the visit?
You do. So when you walk in the room, you educate the patient, say, we're using a new technology to capture the and make sure that they're okay with it and get their consent. So quite frankly, I've taken care of a lot of patients for a long time, 20 plus years, and I never have my phone in the exam room with me. So one of the first things that they noticed was I walk in holding my cell phone, which have never done before. So that prompts the conversation of, hey, we're using a new technology. Are you okay with that?
Has Dax Copilot impacted the way you provide care for your patients?
I think it's positively impacted it because it allows me to, again, focus more on the patient and not trying to capture everything that's documented, not sitting behind the computer. I'm able to roll, sit on the stool and roll right up to them and have a face-to-face conversation. And again, it allows me, as you're talking through your assessment and plan, it's a chance to provide education back to the patient, make sure that they understand. So there's a win-win, right? You're educating the patient, and the tool is capturing the information for the note.
So you mentioned earlier how Dax Copilot brought back the joy in medicine. So go into more detail about how Dax Copilot impacted you personally.
Yeah, it's personally impacted me because even though I only see patients 1 day a week, I don't have the notes hanging over my head. man, I got to go back and finish all those notes. And quite often I was on the naughty list where, we send out open notes, people who have open charts over 2 weeks, and people would come to me and say, "What are you doing on the naughty list with open charts 2 weeks later? Aren't you supposed to be able to do all this stuff?" So, I mean that's a personal anecdote, but it really, I mean, it's impacted me personally. Again, bringing back that face-to-face interaction to where it's fun again. It's fun to take care of people and not have this burden of documentation hanging over your head.
Adopting new technologies, of course, can be challenging for physicians with so many demands on their time. So, describe how you approach changes to your clinical workflow and what you would say to someone who may be skeptical about adopting AI powered solutions like DAX Copilot.
Yeah, I think you'll always have people that are early adopters, and so when we rolled this out across the network, we targeted some early adopters. There's people that are early adopters with all technologies, and I think you're right. I think that created some champions across the network. One of the things that we did, we have an all partner meeting once a year. We get all 1,500 employed providers either in a room or online. We had about 500 people in a massive ballroom at a local hotel, and we did a demo. We had two physicians on stage. They role played a primary care visit and used DAX Copilot to do the documentation. And you could literally see the jaws drop around the room because it was accurate. And this was in a room, it's always a little hairy when you're trying to demonstrate
Mhm.
technology in front of a ballroom like that. And so it was fingers crossed that it worked. It worked. And people, I mean, people were jaw dropped. We had two pieces of feedback. The first piece was, man, when can I sign up for that technology? Like, I can't believe that it's that accurate in doing that. And the second funny thing, and you'll understand this being a primary care doctor, the other piece of feedback that we learned was from the specialist saying, "You talk about all of that during a primary care visit?
Mhm.
I can't believe that you talk about, their family and their mood and their all these types of things. Whereas when you're a specialist, it's one problem and one solution." So I say that tongue in cheek, but we got a lot of feedback about, man, I can't believe that all that goes on in a primary care visit.
So, talk about the general feeling about DAX Copilot after implementation among your colleagues at Community Health Network. How has the response been in general?
Yeah, the response has been overwhelmingly positive. I mean, I think that with any new technology, it's got its growing pains. I won't sit here and say that it's absolutely perfect. I mean, we've had a lot of conversation and communication with Nuance about where we want to see enhancements and improvements, but that's normal technology, right? Nothing rolls out and it's perfect. But I think the sentiment overall, the feeling is, hey, this is a game changer, right? We've had virtual scribes for about 200 of our 1,500 providers. And now we're able to roll out virtual AI scribe, ambient listening, DAX Copilot to all 1,500 if they want it. And so, really, there's an equity in resources when it comes to our providers. So, the sentiment is very positive. There's always the skeptics of new technology and what does this mean? Is it going to change my workflow? But that's no different than anything, right? Think about when we roll out an EMR or other technologies. There's just a learning curve, and eventually people will adopt it and it becomes part of their normal workflow.
Now, as you look to the future, how do you see technology and AI evolving in healthcare?
I think we're going to see a lot more adoption. I think we're going to see a lot more adoption of AI. I think in the direct patient facing, it's going to be a little bit longer to adopt AI. I don't think we're going to see wholesale replacement of doctors and nurses and pharmacists, but I do think there's a lot of opportunity to help clinician assistants to make their job more efficient, to surface information that may be buried, to help with quality and safety measures. I think that's where you're going to see probably the majority of technology evolve over the next 5 years. We might get there in 10 or 15 for some of those other things, but I think there's a huge burning desire to, how do we augment staff so that we can do more with fewer staff? I mean, we all have staffing constraints and problems. How do we improve access? How do we improve health equity? How do we improve some of the outcomes? I think those are some of the things that we really have to focus on over the next 2, 3, 5 years in technology as we start to look at. And I do think generative AI is going to be a huge game changer in healthcare. I think that's one of the areas that some of the technology's been limited, but with the ability to summarize a lot of that unstructured data, which over 80, 90% in the EMR is unstructured, that's going to be a huge game changer when it moving forward.
And my final question, Patrick, let's end with some of your take home messages that you want to leave with the Kevin MD audience.
I think the first one I would say is healthcare is constantly changing. Change is it's part of what we do, right? There's new treatments, new diagnoses, new condition, new everything. So change is part of what we do. And so I think I would encourage people to be open to change, and doesn't mean you have to just run to every change, but to be open to change, open to new technologies. And I think you have to be open so that you can, you know, adapt or adopt technology, adapt to technology or adopt technology so that you can focus on things that don't change, meaning the things that clinician patient, a doctor patient relationship, that doesn't change, right? At the heart of healthcare, at the heart of medicine, it's still people taking care of people, and that's what we need to get back to. And I think that's where technology can help. So I encourage people to be open to change so that you can get back to the things that don't change.
You've been listening to a special sponsored episode brought to you by Nuance, a Microsoft company. We've discussed improving care with AI powered solutions. For more information, go to nuance.com/Kevin. That's nuance.com/Kevin. You can also click the link in the show notes. Patrick, thank you so much for sharing your perspective and insight. And thanks again for coming on the show.
Absolutely. Thanks for having me.